Okay, hello friends, welcome back to my channel Medicine About 01. Today we'll talk about congestive heart failure. Okay, so before starting the topic, let's clear the terms over here. Okay, so first let's talk about the heart failure. Means basically we see whenever the heart is not able to pump the blood, whenever the blood not ejected. Okay, as a result we will see there will be what congestions or depositions or accumulations of the blood in the different organs. For example, it may be accumulated within the liver, it may accumulate within the lungs. Okay, as a result we will see congestions. Okay, so that can be seen in a nutshell, that congestive heart failure. Okay, now I'll start with the very basic physiology, then I'll go to step by step. Okay, now see, whenever the heart that is pumping the blood in 1 minute, that is known as what? Cardiac output. Whenever the heart is pumping the blood within 1 minute, okay, that is known as what? Cardiac output. So let's write it over here. Basically we know that cardiac output, that is equals to what? Heart rate multiply the stroke volume. Okay, now see, whenever the heart is not able to pump, as a result, whatever the problem we will see, the ventricles are not able to eject the blood. The stroke volume, definitely that will be less. So whenever the stroke volume that will be less, definitely what we will see in this case, the heart rate that will get increased. So just heart will try to compensate. As a result, we will see the heart rate that will be increased in these cases. So the patient, they can say, I can feel the heart rate, and as a result, this type of thing we can say over here. The first thing we will get the palpitation. We will get over here the palpitation. And in these cases we will see what type of the thing that will be activated whenever the stroke volume that will be less, heart rate will be increased. In these cases we know basically what the sympathomimetics, activations. We will write it over here, that sympathomimetics. This thing will be activated, and whenever activated, whatever the next thing you can see over here. In these cases we will see that there will be presence of the sweating. In good order we can say the diaphoresis. We will see also the sweating over here. Now try to understand. For example, is the, okay, let me show with this one. See, whenever the heart is not able to pump, okay, now try to understand from here. It is not able to pump the blood in the forward directions, in these directions. Okay. Now as a result, we will see the blood that will be what? Accumulated where? The blood that will keep on accumulated over here, and whenever the blood that will get accumulated where? Within the ventricle, the blood will see also the pressures within the atrium that will be also increased. Here we will also see the what? The blood that will be increased. Now see, we know that from the lungs, we start to understand from here. Okay, from here through the venous route, that the blood that will come over here. Now as a result, we will see the blood that will also accumulated where? Within the lungs. We will see the blood that will be accumulated within the lungs as well. Now whatever the problem we will see over here, in these cases we will see the dyspnea. We will get what? The dyspnea. So whatever the problem we will see the dyspnea on exertions, or we can say the dyspnea on resting conditions also. Okay, sometimes we can see the dyspnea on the resting conditions definitely also, and also in terms of the dyspnea on the exertions. Okay, now in these cases we will also see that the individuals, okay, that what, whenever it will be just keep the blood that will be accumulated within the lungs, we know within the lungs over here there is the presence of the J receptors, and whenever it will be irritated, stimulated, that will produce the cough. We'll see the coughing over here. Okay, so along with that we'll get over here. For example, I'm writing, okay, let's write it over here. We'll get the coughing over here. Okay, and in these cases we'll get on top of the special features that is known as Pro3 sputum. Prosthy, I think so. Anyway, sputum. Now this is the pink color sputum. Okay, we can also see sometimes these things. Now the problem which after that, at what level we will see the problem, there will be the problem as far as the sleeping cycle is concerned over here. We will get for these things. Okay, here we will get proximal nocturnal dyspnea, we can get the orthopnea. Okay, in these cases we can get this type of thing. Okay, now The last on, let me write it over here. We'll get the effort intolerance. We'll get it over here. The effort intolerance that will be present. Effort intolerance. Try to understand from here. Whenever the blood is not able to go from the left ventricles to the systemic circulations, so the blood that will be not supplied to the different organs. Whenever the blood is not coming in the different organs, definitely we know with the blood what the oxygen will come. The oxygen will help to produce the energy. Whenever the blood is not coming, definitely oxygen, there is no, there is no fine telling that definitely oxygen, there will be deficiency of the oxygen. Whenever we are not whenever we are not able to utilize the oxygen, as a result we will not be able to produce the energy. So definitely what you used to do before, for example, you could go from the, for example, from the down to up, for example, the 10 years, up and down, but 2-3 times you could do before. But whenever this type of the problem you will see, okay, whenever the heart is not able to pump the blood, after that you will see, yes, it's not possible for me, I can't do it anymore, okay. So that is known as the effort intolerance. So this type of the problem we'll see as far as the, whenever this type of the system that will be activated. I mean, in terms of the sympathetic sympathomimetics, we'll get the first two things, okay. And whenever we will get the pulmonary congestion in these cases, so let's tab the thing over here. So whenever we will get to the what? Pulmonary congestion. And this thing will get over here. This thing will get in terms of the failing in forward blood flow. Forward blood flow. In these cases, we will get this type of the problem. Okay. Now, let's talk about some examination findings. What are the we can do the examinations over here. Now try to understand from the basic things. See, let me show over here. Whenever I am saying the heart rate, that will be increased. Maximally the heart rate, if I say maximum heart rate, that can be seen 220 minus H. But it's, you can see in these cases in the young individual, who is fit. But this type of thing we cannot see in terms of the, for example, it's not seen in terms of the individuals who is more than 60 years old. So it's not possible, for example, who is more than 60 years old, it's not possible for them, okay. So we will not see this type of the heart rate. Heart rate physiologically you can say 220 minus H. Whenever someone is running or doing the exercise, okay, in these cases we can get this type of the thing. Now we'll talk about the what type of the examinations findings we can get. On examination finding, what type of the thing we'll get over here. Okay, so let's write them one by one over here. So for that thing, let me erase this part. Hope it's clear for you guys. Now, let me show this part. See, on examination finding, what are the thing? The first thing, whatever the problem will get, definitely will get the tachycardia. No problem. Okay. Now we'll get some problem as far as the clinical manifestations on the examination is concerned. We'll get whatever the problem. We'll divide these things into two ways. First, let's talk about left ventricular failure. I'll talk about then the right ventricular failure. Okay. Now see, whenever the left ventricle is not able to eject the blood, for example, let me show once again. Try to understand from here. Whenever the blood is not able to eject it from the left ventricle, the blood that will keep on accumulating within the left ventricle. As a result, we will see that there will be dilations of the left ventricle. So we will get what? Left ventricular dilations. We get the left ventricular dilation in these cases. Okay. So the first thing we will talk about what type of the problem we will see whenever the left ventricle is not able to pump the blood. In these cases, whenever the blood is not able to go from these regions to outside, okay, that means through the aorta, to the systemic circulations through the aorta. So definitely in the first things we'll get what? We'll get the systolic blood pressure, that will be definitely less. Okay. And the next point, whenever the blood is not able to go to the different regions, for example, if we just say in terms of the kidney, try to understand from here, within the kidney the perfusion, definitely that will be also decreased, and whenever the perfusion that will be decreased, the problem is you will get the oliguria. You get oliguria. Okay. Now the third thing, whatever the problem we will get over here, just try to understand from here that we will get third heart sound. I mean in terms of the H3 that will be positive. Try to understand why. See, whenever we are talking in terms of in this way that let's draw once more to make it more clear. See, I have already explained. We will get what? We will get left ventricular hypertrophy, or we will get the dilations, for example. So whenever we will get left ventricular dilations, okay, let's do it this way. So see, in this case, whatever the problem will see, whenever the blood that will come from the atriums to the ventricle in this time, we'll see what there will be a turbulence. We'll see there will be what the turbulence. This will get the turbulence because the blood that is hitting the myocardial wall. But then right now, whatever the problem, the ventricle that is getting dilated. So whenever we'll see the blood is coming in these directions, as a result, we'll get the turbulence. So whenever we are getting the turbulence in these cases, we can hear the word third heart sound. That means H3 that will be positive over here. Okay. Now we'll also see, we'll be also able to hear the bilateral fine crackle sound. Bilateral fine crackle sound, or you can say the crepitations. No, and we say the crepitations. For example, something we are opening this way, and for any object we are opening the covering, and this time we can hear this sound, the crackle sound, or you can say the crepitations. Okay, so bilateral fine crackle sound we can see in this on these conditions. Okay, and then another type of the problem that we'll see over here. For that thing, I have to draw a little bit of the lungs. So try to understand from here. For example, is the lungs. Okay, let's do it a little bit. Okay. Now, what do we know that? Try to understand from here that whenever the blood is not able to, whenever by the left ventricle the blood is not able to go out from the ventricles to the through the outside. As a result, we know the blood that will be accumulated over here. From here, it will go to the lungs. So whenever it will come within the lungs, we'll see. Let me write it over here first. Know the directions over. Let me show the different one. This thing is known as costophrenic angle. Costophrenic angle. Okay. And this angle, this is known as what? Cardiac phrenic angle. Cardiac phrenic angle. Okay. Now try to understand whenever the blood that will be accumulated within the lungs due to the gravity. Try to understand due to gravity the blood would like to get accumulated where in these regions. So at first we will get the accumulations of the blood where within the costophrenic angle. Now whenever the blood will be too much accumulated too much, definitely after that we will see the blood that will start accumulating where in these regions. We will see the blood that will get accumulated where within the cardiac phrenic angle in these regions. After that we will see at a time, we will see the blood, definitely the pleural effusion we can see over here. For example, the blood that is getting accumulated in these regions. Now see, whenever the blood that is accumulated in these regions, so the pressure within these regions that will be more. So whenever the pressure that will be more, for these things will get whatever the problem. See the pressure that will be much more, and whenever the pressure will be much more, they will just what? The pressure that will be applied on the lung parenchyma. So the pressure that will be applied on the lung parenchyma. Now whenever the pressure will be over here, definitely if you just hear the breathing sound, the intensity of the breathing sound that will be less, so that will get decreased. So as a result, we will see the intensity of breathing sound, definitely that will be less because of what? See, whenever the accumulated fluid they are applying the pressure, so on the lung parenchyma, definitely as a result we will see the intensity of the breathing sound that will be definitely decreased in these cases. So another type of the problem we will get in these cases. So you can say bilateral air entry. Okay, let me another name for it. Bilateral air entry. Okay. So this type of the clinical manifestations we will get in as far as the left ventricular failure is concerned over here. Okay. Now we will talk about whatever the problem we will get in terms of the right ventricle. Now in terms of the right ventricle, for that thing let's draw a little bit. Okay. Okay. Now try to understand from here. Is the right ventricle? Is the right atrium? Okay. Now see, whenever we'll see the blood that will get accumulated in these regions, whenever we'll see the blood that will get accumulated in these regions in the right ventricle, from here, okay, whenever it will be not able to pump the blood through the what? Pulmonary artery. So we'll see that after that we'll see the blood, there is a chances of the blood that will be accumulated from here to the right atrium, and from here we'll get the, in this regions, in the jugular regions, we'll get what the first thing we'll get over here, the jugular venous pressure. The jugular venous pressure that will be increased severely, okay? Jugular venous pressure that will be increased in these cases. Now, whenever we are getting the jugular venous pressure that is getting increased in these cases, now another type of the thing we'll see over here, that is known as Kussmaul sign. Okay, let me use this one over here. Okay, so okay, let's use this one. We'll get Kussmaul sign. So Kussmaul sign that will be positive. Try to understand from here. Whenever the jugular venous pressure that is getting increased, but whenever we are just after the expiration, definitely the pressure is supposed to be reduced. Okay, but in these cases we will see still there will be no change in the jugular venous pressure changes. That means it will be still increased over here. Okay. Now for any regions, if we just do for these things, if we just do for from the aspect of the hepatomegaly, see. Okay, let me say before that thing. So whenever the blood that is getting accumulated over here, so as a result we will see from the liver through the what? Through the inferior vena cava. In these regions, okay? Inferior vena cava, we will see the blood that will be not able to get drained from the liver. As a result, we will see the blood within the liver that will be accumulated. As a result, we will see there will be development of what? Hepatomegaly. Now in this time, if someone compresses the liver, as a result what? The blood is supposed to go from what? From the liver to the via the different kinds of the veins. It will go where? Within the inferior vena cava. From here it is supposed to go to the right atrium. From here it is supposed to come the right ventricle. But as we see over here, there is no space for the the blood that is coming from the liver within the right ventricle. So the blood that will come over here, and that will increase, or that will cause the more damaging problem where within the jugular venous pressure. So in this case, we will see if someone compresses the liver for 10 seconds. If someone compresses the liver for 10 seconds, then what we will get over here? Abdominal jugular reflex. Abdominal jugular or reflex. The blood from the from where? From the liver that will go where? Within the abdominal. By the abdominal regions, it will go within the jugular venous regions. Okay, this thing is known as abdominal jugular or reflex. Okay. Now another type of the thing we'll get over here. Whenever the blood that is getting accumulated in the different regions, as a result, we can see different kinds of the edema. That is known as, one of them is pitting pedal edema. We can get the pitting pedal edema. So these are the clinical manifestations. Okay. First I did talk about the basic physiology, then I did talk about the clinical manifestations. I have already uploaded one video where I have discussed in terms of the drugs that we can use in terms of the congestive heart failure. Again, we will talk about the different kinds of the treatments in terms of the internal medicines in the next subsequent part of the videos. Okay. And if you think this video is helpful for you, please do like and subscribe my channel if you are new, and please share among your friends as if they can also get the benefit from me. Okay. Thanks for watching. See you in the next video soon.